One of the big challenges with autoimmune diseases is that there are so many of them, and some of them are very prevalent. But there are so many other ones that only happen in a few patients. We call them rare or ultra-rare conditions, and they don't get the same attention because the other ones, they have a big patient impact, but also big societal impact. But for a patient, that doesn't make a difference. Your life is impacted, and that should be more realized by policymakers. The first challenge that we see with most patients is misdiagnosis and a long time to make the right diagnosis. Second, for many of those diseases, there is still not a treatment. There is not sufficient research to understand what can work and what cannot work. And then finally, their quality of life is terribly affected. And it's our responsibility as a society to leave no one behind and to help them getting alive again.
For CIDP patients, there is many challenges that they have to face. The first one is around diagnosis, because the diagnosis errancy or wandering is around 1 year, but it can be 16 years. So there is a lot to do around that. Once the diagnosis is on, you have to be treated. We know that early treatment is very important for patients because it avoids irreversible damages on the neurological system, for example. Patient perspective is crucial, especially if you consider the health system. The system who is not dedicated on patient, if you consider health care system, will miss something for sure.
So we, as a doctor, I have to touch my own nose, of course. We have a disease set that we have to listen to the patients because they experience not just symptoms, they even more have a burden of disease, which we should maybe quantify with quality of life data assessments, but also taken into account what does it mean for their social life, their work life, and how we could improve that. And with the ideas from the patient, we go back to reality and make everything more powerful.
We need indeed to improve first research, innovation, the importance of having also industry in Europe. And so we believe this is a much broader topic than specific medical topic.
We need to invest more, in my view, in what we call early detection of those rare diseases to avoid that these patients have this odyssey of many years before it is realized what they have. So this should be a European initiative, not an individual member state initiative, because member states alone cannot do that because of the rarity of those conditions.
To have a precise diagnosis, we need precise data. And in research, it's not just necessary to discover new things. I like that, definitely. But we are on the way to share data, to make them interoperable, and to standardize also things like biobanks, to make the entire framework and then to create an ecosystem for autoimmune diseases.
Let's invest into a new European ecosystem, about 25 billion euros, and we will achieve much more effective results in innovations, in treatment, in new devices. And of course, we can say it is about European health autonomy, and it's about the possibility to use made in Europe. And we can deliver to globe new orphan drugs, new vaccines, new antibiotics, new devices, new technological treatment, and new personalized medicine options.